It's time to start the exercises for heel spurs. Exercise 1. Massaging the soles of the feet. You need a BLACKROLL mini for this first exercise. Standing up, place the BLACKROLL mini under the sole of your foot and let your toes hang loosely down. Shift your weight onto the foot that is on the fascia roller. Slowly roll your foot back and forth while applying steady pressure. You can reach the entire sole of your foot, including the inside and outside of the foot, by tilting your foot to the left and right. Find a painful spot in the sole of your foot and apply pressure to it for about 10 to 15 seconds. Roll the sole of your foot forward and back again. Switch sides by putting your other foot on the roller. Shift your weight onto the foot that is on the fascia roller. Using steady pressure, slowly roll back and forth along the sole of your foot. Find a painful spot on this side and keep applying pressure to it for about 15 seconds. Roll the sole of your foot forward and back again one last time. Exercise 2. Massaging the calves. You need the BLACKROLL DUOBALL 12 for this exercise. Sit on the floor with your legs outstretched. Place one foot down on the floor with the knee up and place the calf of the other leg on the DUOBALL. Raise your buttocks and slowly roll through the calf area by bending and stretching the leg that's planted on the floor. Turn the leg that is lying on the DUOBALL inward and outward to reach all of your calf muscles. If you don't have a DUOBALL at home, you can use a BLACKROLL instead. Find a painful spot in your calf and apply pressure to it for about 10 to 15 seconds. For additional mobilization, make circular movements with your ankle. Massage your calf again. Now bring your buttocks to the floor and switch sides by placing your other calf on the DUOBALL. Raise your buttocks and slowly roll through the calf on the other side by bending and stretching the leg that is planted on the floor. Turn the leg that's on the DUOBALL inward and outward to work all of your calf muscles. Find a painful spot on this side and keep applying pressure to it for about 15 seconds. For additional mobilization, make circular movements with your ankle. Roll back and forth over the calf again. You're done. Exercise 3. Triggering the soles of your feet. You need the BLACKROLL Trigger TMX to release deep muscle tension. Sit on the floor and place the trigger on the floor in front of you. Find a painful trigger point in the sole of your foot and position it on the trigger tool. Maintain slight pressure. Take several deep breaths and feel the intense pressure of the trigger. Once the pain starts to subside, begin alternating between bending and stretching your toes. For optimum treatment, keep applying the pressure for about 3 minutes. By the way, the trigger tool uses an acupressure technique that enables you to release deep-seated tension, in other words, painful myofascial trigger points. Trigger points are local areas of muscle tightness in the skeletal muscles. The massage therapist usually uses their thumb to treat the painful trigger points. The BLACKROLL Trigger TMX acts as your therapist's thumb at home. Using the trigger can take a while, but it is important to maintain the pressure for at least 3 minutes in order to stimulate the circulation in your tissue. Keep going. It will be over in 30 seconds. Switch sides by putting your other foot on the trigger. Maintain slight pressure. Take several deep breaths and feel the pressure of the BLACKROLL Trigger TMX. Relax. Once the pain starts to subside, begin alternating between bending and stretching your toes. This is how you create additional mobilization. Keep applying the pressure on this side for at least 3 minutes as well. You're halfway there. Keep going, it will be worth it. The last 30 seconds. Lift your foot and come out of that position. Exercise 4, triggering the calves. You will need the BLACKROLL TMX trigger for this exercise as well. Start in a seated position with your legs stretched out. Place the trigger on the floor and place your calf on it. Find the point where you feel the most pain. Keep applying pressure to the spot, take deep breaths, and try to relax your calf muscles. For additional mobilization, you can now raise your foot and stretch it. Apply the pressure for a total of 3 minutes in order to optimally trigger the spot. If you want to make this exercise more intense, place your free leg over the other one. Remember that the pressure is important, but you need to feel comfortable doing it. You're halfway there. Hold out as long as you can for optimum results. You're almost done. Just 30 seconds to go until we switch sides. Now switch sides by putting your other calf on the trigger. Once again, find the point where the pain is greatest and stay there. Keep applying the pressure for a total of 3 minutes. Once the pain starts to subside, begin alternating between bending and stretching your foot. Place your free leg over the other leg again to increase the pressure on the tissue. You may have some bruising or sore muscles tomorrow from the triggering. There is no reason to be concerned. In this case, take a break for at least 1 day between sessions. If you feel there is too much or too little pressure, vary the pressure with your free leg. Trigger for the last 30 seconds. Three, 2, 1, you're done. Lift your leg and slowly come out of that position. On to the next exercise. Exercise 5, stretching the calf muscles. You need a BLACKROLL mini for this next exercise. Start in an upright standing position, placing the ball of your foot onto the BLACKROLL mini. Bend your knee and shift your body forward to increase the stretch in your calf muscles and in the sole of your foot. Stay in that position for 1 minute. If the stretch hurts, bring your knee back a little. Switch sides. To do this, place the ball of your other foot on the roller. Bend your knee and shift your body forward. You should feel a slight stretch in your calf muscles. Stay in that position on the other side for 1 minute. If you can, take a deep breath and lean into the stretch a little more as you exhale. The last 10 seconds. Push your knee back and return to the starting position. Exercise 6. Mobilizing the sacroiliac joint. You need a BLACKROLL fascia roller for this next exercise. Place the BLACKROLL on the floor and lay the lower part of your sacrum onto it. It's located between your lumbar spine and your coccyx, tailbone. Using your hands, draw one leg toward your chest. Keep the other leg outstretched. Slowly rock back and forth with your outstretched leg. Switch sides after about a minute. A blockage of your sacroiliac joint can increase the likelihood of developing a heel spur, but you can prevent this by mobilizing the joint. Switch sides by bringing your outstretched leg to your chest and stretching out your bent leg. Start the rocking movements again. By the way, a nice side effect of this exercise is that you also stretch your hip flexors, which are often shortened. And 5, 4, 3, 2, 1. Slowly come out of the position. Exercise 7. Activating the soles of the feet and calves. For this last exercise, stand in an upright position, feet hip-width apart. Keep a slight bend in your knees. Gently bounce on the spot. Make sure that your movements are springy. As you go, bounce loosely to the right and left as well to work all parts of your tissue. The pulling and compressing motions of this exercise help build collagen fibres and restore function to your fascia. And 5, 4, 3, 2, 1. Your heel spur exercise routine is finished for today. We hope your heel spurs heal quickly. See you next time.